just come out of a sickle cell patient group and I'm honestly furious. In 2026, sickle cell patients are still receiving subpar care in A&E and I've had enough. Today I heard the story of two sickle cell patients, both who haven't had admissions for several years, one of whom their last admission was in 2017. So they have been able to manage their sickle cell pain for almost a decade without being hospitalized. Both these patients were still treated like drug seekers, still questioned about why they presented to A&E, still questioned about how severe the medical professionals thought their pain was. Whilst they were waiting in A&E, they were left without water. Hydration is sickle cell 101. Left without water and left without pain relief for hours. And this is unacceptable for many reasons. 1, their sickle pain wasn't treated. 2, in the No One's Listening report, it was made abundantly clear that when a patient with sickle cell is presented at A&E, pain relief must be given within 30 minutes of their arrival. And this shouldn't be optional guidance. This is known, this is agreed, this is documented as the best way to treat a sickle cell crisis. And a sickle cell crisis is not just about pain. There is a blockage in a blood vessel. The sickle cells have clumped up and are preventing the flow of blood, which means that oxygen, iron, other nutrients are not reaching tissues and organs. The main causes of death in people with sickle cell are seizure, stroke, and organ failures. It is outrageous that people are being left in A&E for hours knowing that they have some sort of blockage somewhere in their body. This lack of care is putting people's lives at risk. If somebody hasn't been admitted in nearly a decade, how are they still being labelled as a drug seeker? That is not a clinical judgment. That is bias that needs to stop. And there are very clear system failures that are happening despite guidance. And this isn't rare. I am confident that every single sickle cell warrior who has ever presented themselves to A&E has had this same experience, whether now, whether 5 years ago, whether 10 years ago. And this is exactly why people with sickle cell delay going to hospital when they are in crisis. I am a sickle cell warrior, and I am not just a patient. I am a practitioner and I am a sickle cell advocate as well. And this is why education and advocacy matters. This is why empowerment matters. This is why I do the work that I do. We cannot keep on normalizing this. We cannot keep on having near misses. This is not acceptable and it needs to change. People's lives are on the line, and I'm sick and tired of our healthcare system not caring about it.